Hello, and welcome to On Becoming a Healer. In 1849, Elizabeth Blackwell became the first American woman to earn a medical degree. Today, women represent 39% of U.S. physicians, and they account for 55% of medical school enrollees. There are extraordinary stories written of these early pioneers who pushed their way into what was an exclusively male profession. There are also some chronicles of women who bridged the gap from then to now, but not as many, and it's easy to assume that we know their stories when we don't. Our guest today, Dr. Ann Walling, is a physician and scholar who's collected a remarkable set of histories from 37 women educated in Kansas in the post-war era. She published a book on them just this year. What I learned from Dr. Walling's book is that the stories they tell don't fit readily into any pre-cooked narrative. But before I introduce Dr. Walling, I'd like to turn to my co-host, Saul Weiner. Hi, Saul.
Hi, Stefan.
So, Saul, why do you think this is an important topic for On Becoming a Healer?
When I first talked to Dr. Walling about her book, one of the things that she mentioned is that when she completed the manuscript and she brought it to publishers, a lot of them were disappointed that it didn't focus more on the Me Too movement issues of the day, the hardship and challenges related to misogyny that women experience and have been chronicled in their journey into many professions, including medicine. And what she said is that when she spoke with these women and she interviewed them, that was not what they wanted to highlight about their lives. These were women who, for the most part, were extremely grateful and felt an enormous sense of privilege that they got to enter a profession that has so much meaning and brings so much purpose to their lives. And that, it was rough at times, but that was not what they wanted to talk most about. And yet, when you read her book, you see that, in fact, they did experience a great deal of misogyny and harassment and disrespect at almost at every point in the process. And so there's sort of these two elements. On the one hand, yes, all that was true. And at the same time, that's not what they want the story of their lives to be about. And it got me to thinking that, I do a lot of research on physician-patient communication. And I'm often asked about studies and what they show. Oh, for instance, are women, in fact, better at communicating than male physicians? Do they have better outcomes? And I'm of mixed mind when I get asked these questions, because on the one hand, they're interesting and valid questions. And in fact, there is evidence that women are more effective communicators with patients, and that even actually in Annals of Internal Medicine study in 2024, that they achieve better outcomes, although the effect was very small. There was I think a 0.23% difference when patients were cared for by women doctors. But the other side of this coin is that it almost implies that if we can't determine that women are better than men, then that's somehow disappointing, which brings up this whole issue of why? I think what these women are saying is that what we bring to the profession is our humanity. And I think that the other thing that comes out, at least for me in this book, and I'm looking forward to reflecting a little bit more on it with Dr. Walling, is what these challenges say about our profession, about the profession of medicine, related to competitiveness, to power structures, and to, and in some cases, just to, misogyny and racism. So anyway, what I liked about this book also, and I think you alluded to it, is it doesn't try to paint an overly broad brush. There are 37 women who are interviewed in depth from around the 90s when they entered medicine up to the 1970s. We see that these women have a lot to share that gives us a sort of a holistic view of what it's like to join this profession and to find meaning in doing that work. So I'm so glad Dr. Walling is joining us, and back to you.
Thanks. At this point, I would like to introduce our guest, Dr. Ann Walling. She is a physician who was born, raised, and educated in Scotland at University of St. Andrews School of Medicine. She moved to the United States in 1980, and for nearly all of her career has served on the faculty of University of Kansas School of Medicine. She's a family physician and has held a wide range of academic leadership and teaching roles, publishing 145 peer-reviewed articles. Dr. Walling transitioned to emerita status in 2017, but has remained very active. Beginning in 2018, she led 2 oral history projects, one smaller and one larger, a qualitative research project, actually, both seeking to portray the experiences of women who came through the medical school at University of Kansas and in the years between 1944 and 1972. And these are in-depth interviews. That second project culminated in a book published just this year. It's called Women in Medicine, Stories from the Girls in White, That title is an allusion to a qualitative study of the medical students at the same university, published in 61, called Boys in White. Hello, Dr. Walling.
Morning, how are you?
I'm great and really happy to have you here. Is it okay if I call you Anne?
Certainly, yes.
You conducted interviews with 37 alumna from the medical school at the University of Kansas in the years 2020, 2021, and analyzed them with your collaborators, Dr. Kari Nielsen and Dr. Morgan Gillum. And start, I'd just like to ask what made you interested in doing this project?
At one stage, I was the associate dean for faculty, and we were concerned about women in mid and later career who were getting trapped looking after relatives, mostly elderly relatives, but all our policies were about childcare. So I had some focus groups of older women physicians to see about policy changes. The other thread was a corridor conversation with a friend. She said, the students keep telling me you were so brave to go into medicine. You put up with so much stuff. You're such a heroine. And she said, I like being on a pedestal. I don't want to burst their bubble, but it wasn't all rough and tough. I had a lot of fun along the way too. So we found that most people in this generation were kind of being cast as Joan of Arc and their entire lives being interpreted through this perspective of all the bad stuff, the misogyny and the discrimination and the gender based abuse. I'm not denying that that happened. That is very real. But the ladies I talked to all wanted to point out that that was only part of their experience and that they had 50 plus years of professional life and they had rich, full lives beyond medicine and through medicine, that they didn't want just to be seen as victims or people who'd been sexually exploited or subject to gender based abuse.
Yeah, there's a way in which we always tell history in a way that speaks to the matter which is of most concern to us in our current political or social discourse. And that can do a real injustice to what happened in the past. And I felt very much in reading your book that that was something you were trying to correct. I wonder if I could share a quote with you from the introduction. You talk about the history of women entering the medical profession, and you say, or you wrote, these ladies were not the first who got a foot in the door. That had been done more than a century previously. But they were the ones who kept the door open and demonstrated sustained competence, dedication, and tenacity that gradually blunted criticism, tempered discrimination, and built often reluctant acceptance that women could be successful in medicine. Is that a summation of the book in some way?
I think the great achievement of this generation of women is to build credibility. That they went to the office, went to the clinic, went to the lab every day and worked hard. They said they took the jobs they could, knocked it out the park, and took the next job. And they just built the credibility as competent physicians, caring physicians, reliable colleagues. That was a huge thing for this generation. And then it became gradually normal or okay to have a woman in a position as a colleague and then perhaps as a supervisor. And they just gradually, brick by brick, built it up so that it became no longer abnormal to have a woman in certain positions.
Prior to reading your book, I assumed that there was kind of a straight line ascending from the first entry of women into the American medical profession in 1849 or 1848 until the present. But what I read is that there were actually waves in and then retreats in which women did not enter the medical profession, both after World War I, I think in the 1950s. What was going on there that there would be progress and then regress?
Oh, well, the historians argue this one out. I had to read an awful lot of background material. At Kansas in the 1890s, there were 30% women in the medical school class.
Wow.
So in the 80s, there were quite a few women in medicine. And then, as you say, it ebbed and flowed. It crashed around the beginning of the century. Some people blame the Flexner Report. Others blame the sort of masculinization of medicine around that time. It stayed low till the First World War, and there was a small increase in women going into medicine due to the lack of male manpower. Then it crashed again during the 20s and 30s, picked up again around the time of the Second World War, and then crashed in the 50s when the writers I read attributed it to this whole culture of domesticity when women were supposed to be cute and in the kitchen and vacuuming in dresses and high heels. It did not surprisingly pick up much in the 60s, but at the same time, there was a big pullback of American women in the sciences in general. And there's a lot of debate as to why it didn't pick up in the 60s. And it wasn't until the 70s, the early 70s, that it began to pick up. So the numbers going into medicine were way under 10% nationally until about 74, around then. And the pragmatists say it was partly social change, partly the turmoil of the 70s, but mainly it was legislation, Title
Yeah.
IX. But even more importantly, it was the fact that the NIH and the big foundations started asking universities to uh, pay some attention to minorities, which in those days included women, in applying for funding. So a combination of social change, funding, and legislation, perhaps. But in fact, some of the ladies who were interviewing in the early 70s said they'd heard rumors that KU had to admit more women because they were applying for big federal grants.
Oh, I see. There's really external pressure. And I did see in your book a quote in 1970, deans in Northeastern medical schools said in surveys they expected men in preference to women unless the women were demonstrably superior. There was this 1971 yearbook quote that you feature, which is how women at least talked in college about how to apply for medical school. Writing in the yearbook, people said you should say, if you're applying to University of Kansas School of Medicine, quote, I'm not interested in money. I want to be a GP and practice medicine in a small town in western Kansas. Proficient in several languages, I have multiple physician relatives, especially faculty and state legislators. I've received awards from Young Republicans, Youth for Christ, KU, and research organizations, and I'm not applying anywhere else. What's going on there? Is that real or is that all mythology?
Well, the mythology of applying to medical school still exists. And I think people applying to many state schools, not just Kansas, feel like they have to swear that they're going to become a primary care physician and serve the rural poor to impress the admissions committee. I think every university has its caricature, perhaps it's research. You have to swear you're going to be a great researcher or you're going to serve this community or that community. They're not quite myths, but these beliefs are entrenched in aspiring medical students.
I certainly was the subject of that kind of mythology in applying to medical school too. Tell us a little bit about the family backgrounds and the family reactions to these women from the 1940s to the 1970s when they said they wanted to go to medicine.
This is one of the surprises because the literature I read said that women medical students came from more affluent families and often had had previous careers, whereas the ladies I interviewed came from very modest families. A quarter of them came from farms, and about half came from the larger cities and towns, and the others came from very small towns. They described their parents as hardworking, frugal. Children of the Depression came up often. This sort of themes coming through. They talked about parents and grandparents who'd had to really struggle to make it through the Depression and then through the Second World War. They talked about fathers who'd used the GI Bill to go to college, mothers who'd been Rosie the Riveter. One described her family as boringly middle class. They were all very keen on education and upward mobility. They really wanted their kids to be educated.
Yes, that came through. And one of the things I was surprised by is that even if there was a bit of skepticism, but not consistently so. One quote I had was, "Father was a bit iffy at first, but once he got used to the idea, he was supportive, proud, very proud." Most of these women, it didn't seem like were opposed by their families in this. What did you make of that?
Well, the best quote I had was that they all said their families were very keen on education and said, do as much as you can do, go as far as you can go, and then kind of got a double take at medicine. They said, we wanted you to go as far as you could go, but maybe not quite that far. There was quite a lot of soul searching about actually getting into medicine. All the families were concerned about paying for education. And then several of the mothers in particular were worried about social implications.
What are those? Were those social implications?
Well, people coming from fairly humble backgrounds going to medical school, which was equated with children of physicians, upper class families, more wealthy families, and that they were really quite concerned about fitting in, making friends, not being of the same social class.
Were the admissions particularly difficult? I'd be curious, what was it like for women trying to make that jump?
And it was awful and hilarious at the same time. The system was very strange. 3 students would be in a room with a panel of 3 interviewers at the same time. So one was trying to stand out against the other 2 and impress these 3 examiners. And it was held over the Christmas break in the middle of winter in Kansas City. So we had stories of people battling through snowstorms to get to Kansas City to their interview and being very nervous and dropping their purses. But the women were all felt that they had been more harshly interrogated than the men who were with them. They were all asked about plans to marry and have children. They were asked strange questions like, "What would you do if your husband did not want you to work?" And that woman said, "Well, I think I would know him better before I married him than that." And there was the other woman, when she was asked, "What is your favorite television program?" She had young children at home, and she just said, "Mr. Rogers." I thought that was wonderful.
And it sounds like some of that continued into the years of medical school. A couple stories really stood out to me. One had to do with uniforms.
Yes.
Yeah, talk about that a little bit.
Well, medical school students had to wear a uniform. There was a white jacket, white trousers, white tie, white shirt and tie. So when girls arrived in fairly large numbers, the medical school hadn't thought it through. There were no uniforms for women, so they had to have them made or made them themselves. The skirt had to be straight and reached your knees and had to be worn with white hose and white shoes. So they were clambering around as medical students were very busy in those days, drawing bloods, moving patients, jumping around. And these skirts were not always very convenient or very modest. So one mother got very irate and stormed into the dean's office with a pair of culottes and said, "My daughter's going to wear these." And the dean said, "Well, as long as they're not pants, they can wear them." So she made 7 pairs of culottes.
We may have to explain these.
Nowadays, they'd be long, baggy pants, but when you're standing straight, they look like a skirt.
Yeah,
So as long as they weren't pants, the girls could wear them. So she made 7 pairs of culottes for the girls in the class to maintain their modesty and be able to move around.
there was a kind of a jocular aspect to the lectures. I think several women remarked that Playboy pictures appeared in some of the lectures, maybe in the OBG lectures. Do I have my memory correct here?
Playboy and worse images were quite commonly inserted into lectures, not just in OB/GYN, but in anatomy and physiology. And it was all a big joke, sort of rampant masculinity.
How did the women see it?
But like all of the gender-based stuff, they kind of rolled their eyes and thought it was a little immature. But then they're faced with this challenge. Do you smile and move on, or do you say that's not acceptable? If you make a fuss and speak out, one risks being labeled as, at best, not able to take a joke, and at worst, as being difficult to work with and real troublemaker. But if you just roll your eyes and smile prettily and move on, you feel like a wimp, and maybe the next time it'll be worse. So there's this continual paradox for women. Are you able to take a joke and smile and be one of the boys, or do you just stand up and be a real bitch about it?
There is a flavor in your book where it seems to me that the women were proud that they didn't anchor their memories on just those things. That was part of the deal, but it wasn't necessarily the structuring experience for them. Do I have it right?
They were just constantly navigating from very small things like how you're addressed to very large things like actual sexual abuse. They had the impression that they felt so grateful to be in medicine, to get to become a physician. That overrode almost anything. They just felt really proud to be there and they were going to get there regardless of what it took. Now, the other couple of points that they kept making was that medical school and residency were very tough on everyone, that
Yes.
abuse was fairly freely dispensed. And the third point was that this was the 60s and 70s, and the world was very different. People nowadays probably have to look at television programs like Mad Men and things to realize that the pervasive attitudes were very, very different.
I appreciate your mentioning that show because I did think about the show Mad Men while reading your book. There were major social changes that happened. What kinds of careers did your interviewees go into, and did they like them?
In those days, they said there was an expectation that women would do pediatrics or one of the three Ps. Some books talk about the five Ps.
Psychiatry, pediatrics, physical rehabilitation.
Pathology.
Pathology
Yes.
and public health. So the women that I interviewed said, of course, they expected us to be pediatricians, psychiatry if you were kind of odd, and pathology if you really didn't like people. But in our group, most people went into internal medicine. And I think that was because the internal medicine department was so dominant at KU at that time. They were the kings and they strutted around and they were the great clinicians. And I think that was why most people went into internal medicine.
Yeah, that doesn't sound like a gender specific thing. In fact, shifting or angling toward those we admire most, those we hold in highest esteem.
Yeah, and also remember these women, a lot of them went into medicine because it was held up as the ultimate. It was the most challenging, the most difficult. We asked them why they chose their professions,
Sure.
and they all talked about the intellectual challenge. They loved solving problems. They loved the patients. They just fell in love with each of the specialties that they entered. And the pediatricians were at great pains to tell me that it wasn't just a I'm a woman, I have to do pediatrics thing. I had this elective at this particular institution and I really fell for it.
You alluded earlier that there were some challenges in trying to sort out how to coordinate with a husband who was often a physician or with a child or with multiple children and family members.
Residency they described as brutal. This would be in the 60s, 70s. Residents were pretty well in the hospital most of the time, and if they weren't in the hospital, they were still responsible for their patients. They talked about the incredible hard physical work of being a resident and the emotional burden. There was a culture of not asking for help or asking for help being seen as weakness. And so they were overwhelmed by the volume of work and the responsibility. The amount of teaching was very variable. It ranged from wonderful, magnificent attendings who really mentored and brought them on to just feeling completely ignored and being used by the attendings. So residency was brutal. And as you said, that was also the time of their lives where a lot of them were having young children. And it was a nightmare trying to balance childcare. They would have more than one babysitter and more than one plan. Especially a couple of the ladies were single mothers, and they had just a terrible time trying to be there for both their children and their professional responsibilities. We talked about residency being brutal, but one of the things that surprised me and hasn't had much attention in the literature was going into practice.
Yes, let's talk about that.
In many ways, such a neglected area, that was a bigger shock.
Why?
They had come through medical school and residency, they were confident in themselves as clinicians, they'd been senior residents, they'd run services, and they stepped out into the profession. And a lot of them had a hard job finding a job. And there were stories of practice groups having long debates and terrible arguments about accepting a woman. It was a big step. It was a great risk. And the physicians and the physicians' wives being greatly opposed to taking on a woman. Many of the women found themselves being offered lower salaries, less resources, and basically told, you're lucky you have a position at all. There's a huge belief at the time that women were not as productive in practice and would be a liability. They'd always be asking for special accommodations. So these women were determined to show they could cut it, that they would be good physicians, that they'd earn their way, that they would make a mark. But they felt very much second class citizens for the most part when they went into practice, and finding a position in practice initially was really quite challenging.
To buttress the story you just mentioned, I'd see this quote, I'll read it to you. I was aware of the negative doctors. I had to prove myself. I was very well received by patients. I listened to them, spent lots of time with my patients. Initially, I was not paid as well as the men or offered joining incentives or resources like remodeled rooms or new equipment. Practiced with that clinic for 35 plus years. I built my specialty department from nothing. Initially, I practiced in ordinary internal medicine exam rooms. As my practice became more sophisticated and involved more surgery, I struggled to do complex procedures in medicine exam rooms. I complained, but the clinic, especially the surgical department, resisted providing more suitable space for my procedures. I had to educate them about how much the specialty had changed. Finally, I put my foot down and threatened to leave, and then the clinic remodeled. But there's a sort of a battle there.
She's a very distinguished dermatologist, and she was moving to the era where it became more surgical. There's another story in there about a lady who had to battle after 7 years to be offered a partnership, whereas a man coming in several years behind her was offered an immediate partnership plus a loan to get established. Even if they've found themselves in a practice, there was not the easy entry into the medical community that the men had, the sort of easy camaraderie, referring patients, taking call, just the general support that the men slotted in easily and the women were always kind of not quite welcome.
How closely or how different is this from your own experience?
I identified with a lot of it. I think I'm a sort of informed outsider because I lived in Kansas for so long and I did belong to this generation. But being in Scotland was very different. I did have all the challenges of having 3 young children when we came here and trying to find a new position was very difficult.
My overall take on the stories that these women tell is that these were people who really wanted to join the profession, who wanted to have the privilege of being a physician, and were willing to go to hell and high water to get there and were successful. And that's what they were aiming to do, and then to have a meaningful career. But I'm curious about your thoughts regarding the extent to which they in turn changed the profession. I know that's a very hard, it's not an empirical question because, of course, there are many other things happening socially in the 60s and 70s as well that changed the profession. So it's more of an intuitive question about ways in which you think that these women may have contributed to changes in the medical profession.
I really don't know. These women kept talking about navigating, met challenges, put their heads down and worked around them. But the profession is so different, and I hope better than it was. Certainly, medical education is nothing like this brutal experience that many of them describe. Whether it's feminine thing or a fact of external forces, they talked a lot about changes in medical practice. They were going through their careers, the 70s, 80s, 90s, early 20s, the changes in moving from practices being owned by the physicians, small group practices, to being bought out by groups, the innovations in treatment and the delight in patients improving. And then they also lived through the disintegration of many practice groups. They talked about medicine that almost as if they had lived through the best of it. They felt nowadays there was a lot that was good and a lot that was lost. They felt a lot of the deep personal connections they have with patients are more difficult to develop and sustain nowadays because of the way things are organized. They're very pleased that physicians have a more controllable lifestyle, but they also wonder about the impact of that on the caring side of medicine. A third of these ladies were still practicing. Some were in their 80s.
Wow.
And even those who were not practicing still were still in contact with patients, Christmas cards and letters and invitations to graduations and things.
Yeah, I do think these women witnessed a dramatic change in medicine, the one that you're alluding to. And, I've often said that I don't think there was ever a golden era of medicine. I think medicine has had its problems. The problems have been different. In the period when these women were entering the profession, medicine was extremely hierarchical and patriarchal. And you talk about your book of the almost unlimited power that service chiefs had, and that with a word or even an expression, they could have a devastating effect on a young physician's sense of self and even on their career, and which of course led women to be extremely cautious about speaking up, even in the face of considerable abuse. And that was the patriarchy in a sense. And then what happened is the sort of for-profit medical industrial complex came along and kind of flattened that hierarchy, which on the one hand made it easier for women to be a part of the profession because the hierarchy was flattened. but at the same time, it kind of turned everybody to some extent into a cog in a machine, and where there was such an emphasis on throughput, and women and men physicians were affected by that, and it changed the nature of their work and the nature of the relationship with their patients. And both of those are problematic. I was struck looking again at this kind of paradox between the joy and excitement and positivity women had about the profession, and also their openness about the abuse they experienced. And I mean, I was just looking now at two contrasting quotes. On the one hand, you wrote, "quote Overall, the participants, the women you interviewed, expressed great satisfaction and sense of fulfillment from their careers and enthusiastically endorsed medicine as a wonderful career for women," with wonderful career for women being in italics. And at the same time, you also write, "Almost all interviewees, again, the women you interviewed, reported that women routinely experienced sexual harassment. Throughout the 3 decades covered by our interviews, unwanted attention, inappropriate comments, and sexist behaviors were part of a medical culture that would now be characterized as toxic masculinity. Sexist attitudes were so deeply ingrained in routine practice that lecture slides, including pornographic images and disparaging remarks about female students, colleagues, and patients, were daily occurrences and regarded as unremarkable." And just a few quotes from women you interviewed. One says, "Was I sexually harassed? Yeah, all the time. Guys would constantly try to do stuff, being grabby, making comments, giving us all the wrong kind of attention." Another one writes, even more ominously, "One of the professors was well known for wanting to have an affair with every single female going through. Nearly everyone was approached. I escaped by the skin of my teeth as I had visitors when he came to my apartment. He was never called out publicly." And then a hospital staff physician would find out when female residents were on call for ER and come in late at night to harass them. There was some physical contact. I mean, it goes on and on. And so there's this extraordinary juxtaposition. Then the other quote that stood out for me, just because it speaks to why they saw the positive. One writes, "There is nothing like being with the patient and their family. Great when that door closes and just you and the patient and the family to figure out what is going on. It's just great. Knowing your knowledge is going to make a difference, making people more comfortable." So you get this overall view of these extremely resilient women. And again, we don't know what women were left behind. This is in some sense, you were getting there's a self-selection bias, right? Because you met the women who made it and who had wonderful careers. They're describing horrific experiences going through training, and yet they were able at some level to brush it off, not without scars, and a number of them refer to scars. But they found immense joy in the relationships that they had with patients, and the meaning that they found in their work. And because of that, wanted to recommend the profession to women, despite what they went through. So I'm left wondering about all those who didn't make it, who became casualties, and the system, because the system itself was honestly pretty harsh.
I thought one of the most fascinating things was I was doing this in the 2020 while the pandemic was on. I was on Zoom to all these ladies, and the Me Too movement was very hot at that time. So we put in a question, what do you think of the Me Too? And we did all this at the very end of the interview when people were loose and talking, because we didn't want to prejudice what they told us by them feeling we were only interested in sexual issues.
Mm.
And the Me Too answers were quite astounding. A lot of them immediately said, "Yeah, about time, go get them, string 'em up." But there was, I think about a quarter of the ladies said, "It's rubbish, ridiculous. You're a physician, God damn it, get on with it." I deal with it. She was a research oncologist still working in her late 70s. She said, "I deal with families every day who are dealing with the worst day of their lives, and you're going to get upset if someone touches your bottom." And there was this sense that you want to be a physician, the needs of the patients, the demands of the program are much higher than your personal niceties. Or most people fell in the middle. Yes, but yes, it's a good idea. I'm terribly sorry. These things should not have happened. But they're very worried about collegiality, communications, healthcare teams being able to work, or research teams being able to communicate and work freely when men felt inhibited or women felt touchy.
You titled that chapter very delicately. It's called The Gender Thing.
It's because I'm still ambivalent. Most women my age are still ambivalent about feminism, the images of feminism, the achievements of feminism. We're still working it out.
Can you say a little bit more about your own ambivalence?
Yes, I think perhaps it's guilt that I didn't stick up for myself more or be more aggressive. But I was like the ladies in the book. You're trying to become a physician. You're trying to build a career as a physician. You're trying to be credible and reliable and competent. you navigate. One story that's not in the books. So I was the only girl. We were sitting in a seminar room after doing patient rounds. We were sitting in a seminar room in a circle. I was sitting next to the professor of medicine, and he was making a point about the renal function of this patient, and he kept putting his hand down on my thigh. I was sitting next to him, just thump, thump, thump. And my husband was then my fiance. He was getting uncomfortable. The guys were looking at him saying, "That's your fiance's thigh that he's grabbing." And the interesting thing is, I have no memory of that incident. Those kind of
Wow.
things were so common that I don't remember it.
Well, I think, you mentioned the fact that there was so much abuse going on that affected male residents as well as female residents. The environment was, as you say, toxic and difficult, that I can imagine women just sort of bundling it into that and just saying, well, this is just part of the process. And some of the women did make comments like that, that, we got to tough it out, just be one of the boys, even though, of course, what was they were being targeted for was something their male colleagues were not being targeted for. But there was just this culture of just you take it.
You had to prove you had the emotional and physical stamina to be a physician.
You know what strikes me about that is before reading your book, I read the book by Olivia Campbell, Women in White Coats, which talks about the very first group of women to enter the medical profession in the 80s, Elizabeth Blackwell, and then two others, Elizabeth Garrett Anderson and Sophia Jex Blake. And these women wanted the prestige and the achievement of becoming a physician and had to go through a lot of the same stuff just in terms of the arduousness of it, the extraordinary amount of material they had to learn, the very high standards, the scrutiny. And yet, this was in a pre scientific era where basically they were learning about the four humors, blood, bile, etc. They were learning about purging and bleeding and cupping and all that kind of stuff, things that have now are regarded as non scientific and actually generally quite harmful. And so, even before medicine was kind of grounded in science, it had these cultural elements of being super tough, prestigious, abusive. And we justify all that now on the grounds that, oh, yeah, there's so much you have to learn. Yeah, you got to be tough to be a physician. And yet we were actually already doing all that stuff before the content or the substance actually had much evidence or scientific merit. And so it's almost like this toxic masculinity was part of the pre scientific era of medicine and is just continued. And now in more recent years has morphed into just for profit medicine, where the values are just more about being efficient and productive.
But one of them made an interesting comment. They had talked very freely about what you would call the joy of medicine, the delight of caring and the honor of caring for patients and the intellectual stimulation and pleasure of solving problems. But one of them commented that they thought they had more fun or more fulfilling careers than the men. She said,
Mm.
when we go to our reunions now, the 50, 60-year reunions, the men are all old and burned out and bitter, and the women are vibrant and chatty. And so they felt in many ways they had had more joyful, more satisfying careers than their male colleagues, which was, I thought, rather interesting.
I think that's so interesting. Women didn't take it for granted. It was not something that they felt. Many men perhaps felt it was owed to them, and for
Yeah.
women, this was something that they felt so grateful to have broken into and to have the joy of being a part of that. I wanted to perhaps conclude by just reading the first paragraph of your book, which really resonated for me. And it's just a description from one of the women you interviewed, one of the oldest women you interviewed. And you write, in the summer of 1934, a 10-year-old girl watched as a seriously injured boy was carried into her father's rural medical office. It was harvest time in Kansas, time for the local boys to shoot the terrified rabbits flushed out by the advancing combines. In the dust, excitement, and confusion, one of the boys took shotgun blast to his abdomen and thighs. The girl's father was delivering a baby at a remote farm and could not be reached. Her mother, a nurse, did what she could to staunch the profuse bleeding and triage his wounds, but the boy had to be put in the back of a truck and driven over unpaved roads to Wichita. I thought right then, if mom had been a doctor, we could have treated him here and not sent him off. I realized being a nurse would be inadequate. I absolutely decided right then to become a doctor, and I stuck to it. And I'm so related to that because it so captures why one would want to be a doctor. And when I was in my teens, I worked as a volunteer EMT for an ambulance squad. And I remember, we would just kind of keep the patient alive until they got to the hospital. And then at the ER, the doctors would come out and they would take over. And I was like, wow, I want to do that. And I can so relate to the fact that this young woman in the 1930s has exactly the same reaction, except for her, the path to getting there was far from evident. But that's what women wanted. They wanted to be a part of something so meaningful. And once they got there, even though it was a really rough ride, they didn't forget. They didn't forget how privileged it was to be a physician. And I think that's probably why at reunion time, they're still energized.
When I interviewed that lady, she's in a nursing home in Appalachia. Everyone I talked to there, the administrator, the social worker, the nurses, all said, Dr. Doris, she's wonderful. She had been a pediatrician to generations and generations of hill people in Appalachia. She was loved. And that was the expression that was made by one of the nurses, that everybody loves her in the county. Everyone in the county knows her and loves her. So there's this lifetime of service from that 10-year-old girl standing in a dusty Kansas street to a 93-year-old lady in a nursing home in Appalachia. Just continual service and care and compassion.
And that says it all. It really does.
Well, I am very thankful that you undertook this work, Anne. The book for people who are interested is Women in Medicine, Stories from the Girls in White with Anne Walling, published by the CRC Press. And I'm very thankful that you took the time to be with us today. Thanks so much.
Thank you.
Yeah, thank you, Anne. We hope you've enjoyed this latest episode of On Becoming a Healer. If you have and you haven't already subscribed, please consider doing so now. Also, please rate us on the Apple Podcast app, as it will help others find us. And if you have a few moments, leave a review. In addition, if you'd like to make a comment about this episode, we'd love to hear from you. There are a couple ways to do that. If you're using the Apple Podcast app, then just open the episode website link and enter your comment there. Or you can directly go to the website contextualizingcare.org, select the podcast tab, and then scroll down and click on the episode. There you'll find the same comment box. Finally, you can always reach us at onbecomingahealer@gmail.com.